OK, so we all get a bit set in our ways with those rituals and routines that we feel compelled to follow, and oddly uncomfortable if we have to change. But there are people with such powerful obsessions involving intrusive thoughts and anxious feelings, coupled with overwhelming compulsions to act in bizarre and worrying ways, that they fall outside the range of what's deemed normal or acceptable. In fact, they're ill. They suffer from obsessive-compulsive disorder, OCD, our topic today. An estimated 1 person in 100 fits the criteria for OCD. In some people it might take the form of morbid fear of contamination, leading to excessive and repeated hand washing. For others, it might be a fear of chaos, which leads them to arrange and rearrange things in carefully prescribed patterns. And those are just 2 examples, there are many more. If you're worried that you or someone in the family is behaving in an obsessive-compulsive way, please call us now. 08700 is the number, 100 044. Or you can email checkup@bbc.co.uk and put your questions about causes, prevention and, most importantly, treatment of OCD. Well, my guest today is an expert in treating patients using psychological techniques for this condition. He's Dr. David Veal, a consultant psychiatrist at the Priory Hospital in North London. We have a lot of callers. We'll go to our first. Genevieve Bliss is in Southampton and has a son with an obsession. A very particular obsession, Genevieve?
Yes, it all centres around the number 13. And about the 13th day of the month, he comes home a couple of days before and stays in one room only and won't go out, and stays here until about the 15th, actually, then returns to where he's living.
So he's a grown-up person, but he comes home to avoid being on his own or away from home on the 13th of every month?
Yes, every month, regularly.
And how do you deal with that?
Oh, I have a very bad time because I'm not supposed to go anywhere either. I'm restrained. I'm kept here on a lead, so to speak. I can go just short distances, but I mustn't go anywhere on a train or a bus because I'm connected with him.
David, have you heard of an obsession of this kind before?
Yes, it certainly can become an obsession. I think the key thing here is to understand a little bit about the meaning that your son's attaching to it. What does he think's going to happen if he does something on a 13?
I don't know. He just says he's very frightened. And it all centres around the number. He was born on the 13th, and on the 13th, at the 13th hour, and the letter M of his name is the 13th.
No, because a lot of people have superstitions about the number 13, so in a way...
For someone else, the 13 may be lucky. So, it's crucial really to understand the meaning that he attaches to it, and it's probably likely to be something to do with preventing harm from occurring, that he thinks, some sort of magical or godlike powers to prevent bad things from happening around the 13, and as therefore he's sort of acting just in case something bad happens.
And is that the pattern then, David, you're saying, in obsessive-compulsive disorder?
Yes, you're sort of got doubts about it, and just in case you're going to act that particular way to prevent bad things from happening. But of course you never then find out whether anything bad happens, and the main approach, if your son was in therapy, would be to really try to help him test out that particular theory, because obviously the problem is that of worrying about bad things from happening, and the more he tries to in a magical way prevent bad things from happening, it just reinforces the worry. It just keeps it going.
Genevieve, has he tried any sort of treatment?
Oh, I've tried lots of things. He gets into a completely different outfit, shoes and shirts and everything, and then he takes them all off and leaves them here on the 15th like a sort of shell left behind him.
So David, if he came to see you, what would be the way of breaking into this vicious cycle that he seems to be in?
Well, ultimately, we want him to do lots of things on the 13 repeatedly to really try to make bad things happen. And it may happen, but only by coincidence. And probably the thing that's going to really help him is how much his life is affected by it, because it sounds like he's adapted to life and everyone around him so as to make things fit in. And so at the moment he can cope and life carries on. He doesn't have to change, it seems.
No.
Presumably it would be very challenging indeed, though, to try and break, if you like, in this case, the habit of a lifetime, feeling that something dreadful is going to happen.
It'd probably be, for many listeners, like asking him to do a bungee jump. It's going to be very scary. And that's the difficulty in trying to help patients to face up to their fears and to test it out.
But, I mean, some of these therapies that you use, David, I hope we'll hear a little bit more about them in a moment. I mean, they clearly are trying to break into this cycle of false belief, if you like. Stay with us, Genevieve, if you will, and I hope that David will have something else to add to what he's already said on behalf of your son. But we'll go, if we may, to another call. We have Hazel, I think, waiting to speak to us in North Wales. Hazel, who is worrying that she may have the start of OCD. What makes you think that, Hazel?
Because I spell everything in my head that I'm saying. As I'm saying it, I'm spelling it. And this has happened once before when I lost my first husband. And now that I'm living alone again, I don't know if it is anything or not. I'm just wondering if it could be. I am taking Dolzapine antidepressants, which aren't really helping a great deal. I have tried a couple of others. I just want to know, really, what I could do to stop myself doing it.
And what do you think would happen if you didn't spell
Nothing.
things?
I don't feel any terror of it. I just can't stop myself doing it.
Bit tedious, really.
It is.
Is it the start of OCD? That was sort of the basis of this.
We don't know. We'd need to do a lot more detailed discussion with you. But, tell us a little bit more about what do you feel any control over it? For example, could you spell it incorrectly?
I don't think I could. No, I would have to look it up, I think, if I couldn't spell it.
So it is perhaps something to do about getting it absolutely right in some way, to do it the right spelling?
I don't know, but as I'm talking to you, I'm spelling what you're saying as well as what I'm saying.
Yes.
And I can't keep up with the words, which makes me quite tense, really.
Yes.
Is it something to do with trying to take control over the words that you're using? If you're spelling them out and you've got to spell them correctly?
I don't know. I don't know why I do it, and I wish I didn't do it.
Well, I don't know what you're trying to avoid in life at the moment. I don't know in the
I've
context.
recently had a divorce, and being disabled, I live alone.
Yes. So it may be just one way of coping at the moment. I don't think it's necessarily a very helpful way of coping in the long term, because obviously some of the problems that might be occurring as a result of a divorce are things that you may not be facing up to or dealing with at the moment.
But is there anything you can suggest that I could stop myself doing it?
It probably needs to be done in the context of seeing a therapist or reading suitable self-help books or getting information, because there's a lot of information out there in terms of books and charities like OCD Action or going to see a therapist. There is help available.
Okay.
And maybe you've done the first right thing, Hazel, to raise it, to be conscious of it and to ask the question. Thank you for that. We got an email from Colin D'Souza in Norwich. He asks very particularly, is there a link between OCD sufferers and anal retentives?
The term anal retentive is a very old-fashioned term for an obsessive-compulsive personality, and in general, OCD is not particularly associated with the personality as such. There's a whole range of different personalities with OCD, so it's not particularly connected at all.
OK, and in fact it sounds a bit of a pejorative term
to
call
indeed.
someone an anal retentive.
Yeah.
Let's go on to the phones again, and we've got Tony in Yorkshire with obsessive-compulsive disorder. What's your question about it, Tony?
Good afternoon. I'm in my late 50s and can say without doubt I've suffered at least for 30 years and probably longer. Mine involves compulsive checking rituals. I find probably over the past 10 years the situation has got worse and I'm now in a sort of pattern with it. I find each day I have to do certain things in certain rooms every single day before I can move on to the rest of my day and do whatever I have to do. Things involving checking taps, checking plugs, checking if I leave the house, checking the front door. It could take 5 minutes to actually get off the front doorstep, that sort of thing. I did see a therapist about 2 years ago and went for several visits to her. And at the end of the day, really believe nobody can help but yourself. The guidance given then was more or less on the lines, well, if you find that you're going to check a particular thing, walk away and mentally count numbers to yourself till the feeling of the desire to check has passed. Well, it sometimes works, but I have to say more than not it doesn't, and you go back and have another look again. And I really just wonder if there is any sort of format you can recommend where you can break yourself from this endless pattern of going round doing the same things quite unnecessarily each day.
Which you've described very clearly for us, Tony. What's the answer, David?
Well, what I think your therapist was using was something called cognitive behaviour therapy. And obviously there are different levels of experience, and you may not have been so ready for help at that particular stage. So it's always worth going to seek a further opinion or going one step up the chains, because there are more specialist centres that deal with OCD. Now, in general, when you're overcoming these types of problems, it's very important to try to combine it with the principles of what we call exposure, that is, facing up to your fears. And so if we take an example, like one of the things you might be for checking light switches, then it's important to try to combine that in some way with deliberately leaving the light on rather than having to check that it's switched off, for example. But this needs to be obviously done in the context of understanding what the problem is, in terms of trying to worry about preventing bad things from happening, just trying too hard, because, your solutions have become your problem. And if even at a more expertise level of CBT is not working, then you may wish to combine it with other medication. So, there's always treatments and therapies that can help. There's very few people who can't be helped.
So you're talking, David, there about a kind of distorted thinking about what will happen if you don't make sure the house is properly locked up. And then you have to, obviously, make sure the house is locked up because you think something awful is going to happen.
Yes.
And not to do that, though, is extremely risky. Presumably that's the problem, Tony. It's just a big risk, isn't it? Not to do what you feel you have to do.
That's right. There's a certain amount of logic so far as the house is concerned, obviously for security, but you know yourself there's no logic in repeatedly going back to, to check you've turned the kitchen taps off when you know absolutely you turn the kitchen taps off, or you turn the lamp off in the bedroom or whatever else.
But one of the problems that's happening at the moment is probably that you're finishing your check when you feel right, when you feel comfortable.
That's right.
And a healthy person will only finish checking when they can see that the tap is switched off or the gas cooker is switched off. And it's going to be important to change the criteria you use to finish the check. So you just use more external or objective information rather than feeling comfortable. You have to do these things feeling uncomfortable, I'm afraid, in order to change.
I mean, someone made the comment to me that what had really helped him with his OCD was that he'd learnt the mantra, actually within a therapy setting, which is take the risk. Take the risk that actually you have left the tap on. I suppose if you can do that, you really have made enormous strides. That seemed to help him enormously.
And because if you don't, the consequences of having OCD for the rest of your life are much worse.
So it's quite a tough message, but are you saying, David, in your practice with your patients, that when people will expose themselves to what they call risky behaviour...
but it's not actually risky.
But it's not really risky, but they perceive it to be, that they actually do well?
Yes, and if you do that repeatedly and really test it out as if this is a problem to do with worrying about bad things happening as opposed to actually bad things happening.
And is it a little bit analogous to the desensitisation technique used to help people overcome phobias?
Yes, absolutely. It's entirely related to that.
Tony, thank you for that. We will move to another caller. Stay listening. I hope you'll learn some more. Phyllis is in Devon, has a son-in-law, probably with OCD, and is about to start his family. So, Phyllis, is there a concern there about whether this is something that perhaps is inherited? I don't know if it is.
Yes, my son-in-law and daughter have been married for about 3 years, I think, and he's 40, and they were at first sharing a flat with other people, and he did find it very difficult to cope with other people's sort of mess and belongings around. So now they have a flat of their own, and but my daughter does still have, and they have to follow quite a lot of rules and procedures. And for instance, if they book a holiday, it has to be absolutely sure that the sheets are washed and all that sort of thing, and the kitchen has to be ordered in a certain way. And they quite openly talk about it. I think they must have had some sort of counselling. I'm not quite sure really exactly what stage, because I sort of don't want to interfere. But they seem to be coping quite well with it at present. But I was just wondering what happens when babies come along and how it could affect you. And I was just talking to someone recently whose mother has an obsessive-compulsive disorder of things in threes, and they had quite a miserable childhood having to cope with it. And I was wondering how things may develop that way. I'd like them to be prepared for that.
Okay. Well, the genetic risks are generally quite low. in the sense that in the population as a whole, only about 1% or a little bit more of the population has OCD. But if you have a relative with OCD, and in this case perhaps a baby, then the chances are increased to about 5%. So it's a very small increase, and I don't think that by itself should stop someone having a family as such. It is possible that when a baby comes along that your OCD may be worse, because of course all your sense of responsibility and so on is focused on the baby.
Right, and there's a lot of mess around.
Yeah, absolutely. It's more common perhaps in women with babies, but it does also happen in men, and when the baby comes along they become very preoccupied about preventing harm to the baby, whether it's contamination or thinking they might stab the baby or all sorts of things like that. So it is common, but it's something that can be predicted and dealt with if the person is in the therapy.
I imagine, Phyllis, it's quite interesting for you, or difficult for you, I should say, really, because you said you don't want to, it's not your place, as it were, but then again, you see what's happening. How do you, perhaps David can answer this, how might family members best deal with it? Do you collude with it, or do you challenge it? We've actually had that question come in from another listener, Mary Elliott. She's saying, what support is available to partners or friends or family, because she, for example, in her case, is never sure when she should keep quiet or whether she should challenge this sort of disturbed behaviour. So, David, what would your advice be?
Well, it's most difficult, of course, of all if you're living with someone with OCD, with severe OCD. And there are lots of different ways that family members cope. Some family member might cope by accommodating it and participating in the avoidance and the rituals. Another family member might might end up being aggressive or sarcastic and sort of not be very supportive at all. Someone else might be trying to cope by just denying it's a problem and trying to work excessively hard outside. So, there's no right way of coping. And in the long term, we want to try to help people, family and friends, not to accommodate it. Sometimes you may need to compromise in the short term to provide more emotional support to help them to change. But it's a very difficult balance. And, one of the key things about OCD is that it is in the top 10 of the most disabling conditions, and according to the World Health Organization, it can cause enormous difficulties in family life, social life, and make difficulties in employment and all sorts of things. And you have to bang on that, it has to be taken seriously.
If I may, I'll leave you there, Phyllis. Thank you for your call. We'll go to Fife in Scotland because I think we're picking up that theme a little bit. Susan wants to talk to us about her son with OCD, and that idea of being a little bit worried about a stigma perhaps surrounding this illness and therefore stopping people going forward for treatment. What's your particular question, please, Susan?
Well, my son is 16 and he washes his hands and he runs up and down stairs and flicks on and off light switches, and we've read about it and we gave him a mantra, but he didn't want to take that on. He doesn't seem to want to sort of help himself that way. What
was the mantra you were offering?
I know it's not easy, but I'm doing fine. I got it out of a book.
Okay.
And we thought about taking him to the doctors, but with this thing that employers perhaps are allowed to see your health records, if it came up that he'd been treated for this, it might not be a good thing for him.
Well, it is an important point for people. If you get a diagnosis of OCD and are referred for treatment, you will have on your medical record that you have a psychiatric illness. That's the problem.
But at the same time, if you don't go and get help, you won't be going to get a job. So shame is an enormous problem and stigma. I appreciate that. But in general, an employer may request a medical report by a doctor as such, but if it's not an active problem, they're not really interested. The key thing is really, for an employer, is can this person do this job at this time? It's not going to be taking off lots of time off work. And it's more important, I think, for your son to actually get help now, because otherwise it will persist and get worse. And unfortunately, saying a mantra like that is not by itself going to work.
So even at the age of 16, isn't it something you might hope, perhaps, as he goes through puberty and gets
I don't know how long
older?
it's been going on for or how disabling it is.
It can't, but he was sitting his standard grades last year, and he nearly stopped writing because he was trying to form a particular letter. But he forced himself through it so he could finish the exam. He's coming up to his higher, which are sort of university entrance. So.
And it may well then interfere in his ability to study and concentrate. And everything.
I think it might do, yeah.
And so I really would strongly urge him to seek help.
Right,
because it's unlikely just to go away by itself.
It's that just through the local GP?
Yeah, just go to your GP and tell them about the symptoms, and say that you believe this to be obsessive compulsive disorder, and you may wish to take along some leaflets and so on. There's lots of information available from self-help books. We have one out. There's OCD Action, the charity, all sorts of things, so that you can arm yourself a lot of information and just say, look, I would like to get an assessment, and we would like to get some cognitive behaviour therapy or possibly a medication and so on and so on. But do seek help.
Thank you, Susan. You might take some comfort in hearing from Margaret, who joins us from London, also with a son with OCD, who's had treatment and is back to normal. So that's good news, isn't it, Margaret? But there's a question arising.
Yes, hello.
Hello.
Yes, my son was 12 and a half when he, out of the blue, the symptoms arrived, and as I spoke to your colleague, explained he's had treatment and he's worked hard at it, and he's had lots of prayer, actually, and he seems to be a whole different person, but obviously worried. He's now nearly 14. What's the likelihood of a recurrence in later life? Or can we just say it's great, it's over?
I'm afraid it is unpredictable, and it is possible that at times of stress and a lot of stress, it may reappear, but at least he'll know what it is and be able to get help at an early stage.
Is there much research done into ex-child OCD? If you know what I mean, somebody who's had OCD as a child, or is it kind of also new?
There's not enough research done into OCD at all.
No.
Full stop. And so in any particular individual, it's difficult to tell whether it will recur.
Yeah.
But if he has relatively short-lasting and he's managed to get better quite quickly, then I think that's a good sign. It's just that it's something he needs to be aware of, that at times of stress it may revert again.
Yes. I mean, I felt in one sense we were lucky that it happened when... It was horrible it happened at all, but lucky it happened when it did, because he had to come along with me to the counsellor, and as he was a minor, he kind of did that. Whereas I know people who've had older children who obviously have chosen not to and can't be made to.
Because it's actually tough, isn't it? As we were saying
very
earlier,
tough.
You're being asked to do something that's really quite challenging and risky and threatening and rather hard. So, Margaret, this was a therapist, a psychologist of some kind, I take it.
Yes. Behaviour therapist.
Yes, and that's exactly, of course, what you practice, Dr. Veal, is it not? There is talk, however, of medication also being used either instead of or in conjunction with behavioural therapy. But that raises a question for Michael Ryan, who's emailed us, and he's saying that the problem is some of these medications are often SSRIs, these are the serotonin drugs, and the trouble is with those, they may have serious side effects. In fact, they're often offered, it seems to me, for a lot of conditions these days. We were talking only last week about premenstrual syndrome, and Seroxat, for example, is one of those that's offered, and yet there are possible dangers. So what's your own view, and what do you recommend patients should do with the suggestion that medication could be the answer?
Well, the draft NICE guidelines on OCD will at present say, and most likely to say, that they are an effective treatment and they can be used for OCD safely. The controversy in the past has been when they've been used inappropriately for patients with mild depression, and that's when they perhaps shouldn't be used. So the problem is not in OCD, and they're usually very effectively tolerated. The main problem is really there's a high risk of relapse, that when you stop taking it, that very often symptoms of OCD may return. And so that's why it's very important to, if you are taking medication, to try to combine it with the therapy at the same time. But in general, you'd normally use them if the therapy isn't working.
Let's take a very quick call, finally, I think, from Susan in Lancashire, who's had OCD for a long time, most of her life. Is doing well, though, now. Is that the case, Susan?
Yes, I think so. I've managed to get to this stage now in my life by three different things, really. Firstly, by taking medication. I've been taking medication for 13 years. Not a great deal. It's an antidepressant, but it is supposed to help with my obsessive-compulsive behaviour, and I think it does. Also by some excellent behaviour therapy, which I've had from the clinical psychologist at the local hospital. It's been hard work, and I've been seeing her for a long time now. But together we put
together a number of strategies, and they have helped me in the house considerably, because my obsessive-compulsive disorder is to do with cleaning and obsessive housework.
Okay, I'm sorry, I know you wanted to list 3. Those were 2 very good ones. We will have to stop you there because we've run out of time, as we always do. If you'd like to hear the programme again, though, find it on our website, or you can ring 0800 044 044 for more information. Thanks to David Veal. Next week, urinary tract infections.